Hello everyone, I'm Dr. Afrin Rajai, and for this week we are going to talk about collaborative language therapy. Collaborative therapy was developed by Harlan Andersen and Harry Goolishian in 1988, and you see their pictures here in this slide. I think this quote by Harlan Andersen says a lot about collaborative therapy. It says, I think of my approach to therapy as a philosophy of therapy rather than a theory or model. Philosophy focuses on questions about ordinary life, self-identity, relationships, mind, and knowledge. It involves ongoing analysis, inquiry, and reflection. So collaborative therapists avoid all these standardized techniques that we talk about in other approaches or theories. They focus on facilitating a unique relational process with clients. So they claim that clients, they are the expert of their lives, and we are not the expert of client's life. All we do is we provide and create this conversation, this relational process with the client, with their collaboration, and we focus on the process. We have this curiosity, and we try with that conversation that we are having with clients, we try to provide some sort of shared, even like curiosity with clients. So therapists in the room, they don't have like control over what's going on. They're not the expert, and they honor clients' agency. As I mentioned in my previous lecture on narrative therapy and collaborative therapy, they are similar, with the difference that narrative therapy is like more structured, and they have these techniques and interventions and specific principles, versus collaborative therapy, that is, as I mentioned, it's more focused on the process, and it's more the focus is on a unique relational process. So they really do not believe in like these specific techniques or interventions. Another quote by Harlan Andersen is that she says, it's not what you talk about, but how you talk about it. So again, like how you talk about it, it's about the relational aspect and the process of what's going on in the session and the conversation. Collaborative therapy as a philosophy rather than a theory really suggests that this stance of not knowing and knowing with clients. So they really go with not assuming anything about clients or their stories, and they are collaborative therapists. They are very, very curious about understanding clients from the clients, right, through the collaboration that they provide and they create. So they really avoid monologues, and they have dialogues with clients, right? So the two key principles of this approach are developing a collaborative relationship between therapists and clients in therapy, and engaging in dialogues that encourage growth and change. Andersen believes that collaborative therapy facilitates transformation for both the person in therapy and their therapist. So the therapist and the clients, they are both, the expert, kind of like the same amount. As meaningful conversations occurs, and there is relational process in therapy, they can explore various aspects or perspective of a story, and both clients and therapists may realize new knowledge and understanding of what they are talking about. So during the collaborative therapy session, the therapist and the person in therapy, they provide this partnership, kind of, right? So the important aspect of this partnership and the conversation that they have is that they talk with each other and not to each other, and that requires active listening for the therapist, and again, like being curious to understand clients' perspectives. So collaborative therapists, they do not believe that they have superior knowledge in therapy. They are willing to have their knowledge challenged, and they are very transparent about their thoughts and opinions. So if they are in a session and they are figuring out or realizing something or feeling something about the conversation, the story, the clients, they always, check that with the clients, and, they are transparent about their thoughts and opinions. So, for example, if a client is talking about their partner and how they are in their relationship, abusive relationship, but at the same time the partner has all these, good qualities, and they cannot leave the relationship, and they repeat all these stories, session after session. A collaborative therapist might say something like, what I'm hearing is XYZ stories, and it seems like you get hurt in some of these stories, but you're ignoring the pain and some of the experiences that you're going through. This is what I think, but I'm curious to know what do you think about what I just mentioned or my comments. So in providing the dialogue or conversations with the clients, they may ask questions, comments, put comments, or make sure that they understand what the person in therapy is saying. So by forming this partnership and relationship, they work together with the client to create a new understanding of their experience, and allowing for transformation. So they really believe that they are flexible, and they really believe that the clients are the expert of their lives, and they are even like a teacher for the therapist, and the therapist they learn from clients and their experiences, and what they are going through. So clients and therapists, they are conversational partners. They call it witness. The witness concept in collaborative therapy. So the real expertise of a therapist is creating conversations that clients are part of it, and inviting the clients to that conversation. Since collaborative therapy is more like a philosophy rather than a model or theory, the goals of this approach is kind of like different. So one of the goals of therapy is that conversational partnership that therapists try to facilitate, right? So therapy is actually a kind of like partnership between the therapist and the client, right? The next goal is about relational expertise. So clients and therapists, they have this joint expertise, and they actually share their expertise together with each other, right? The next one is not knowing, and we already talked about it, just that cultural humility and being humble, and learning about the client from the client. The next goal is being public, which is about the one that we mentioned before. Therapists, they are open, they share their thoughts, opinions, and feelings in therapy. The next one is uncertainty, which is about the fact that because of this whole philosophy and all the different things that we already talked about, therapists actually appreciate the spontaneity of a conversation and in a conversation, right? So uncertainty is a part of life, as just a life package, and as a part of their philosophy, and because uncertainty brings anxiety and stress, and all these different things in our lives and in our conversations. So they try to appreciate it and accept it instead of running away from it. And the last one is that mutual transforming, which is about both the client and the therapist, and how they can learn from each other. And it's not just about the client, learning from the therapist. It is not that. It's that mutual transformation. So how does collaborative therapy help clients? So in collaborative therapy, the therapist is on a kind of like journey with the client, and in that journey they try to promote collaboration. So it's more about collaboration and that relational process. Through that collaboration and the journey that they are on, the therapist helps clients to identify patterns of their behaviors and the roots of them, through the conversations that they are having. And they invite the clients to create new meanings for their beliefs, and they use the techniques that they are using, again, like it's different from other approaches that we talk about, but kind of like some of the things that we use in therapy in general in most of the theories and approaches. But this one, collaborative therapy, really focus on curiosity and questioning, and that journey of exploration to discover clients' belief. So as they believe in social constructionist view, and as they use that view, they really believe that reality is socially constructed, and it's whatever is we are dealing with, it happens through all the conversations and dominant discourses and dialogues that we have. And because of that, with the journey and dialogue and collaboration that they are creating and facilitating, they try to promote acceptance in clients' life. So some of the interventions that we can talk about in collaborative therapy, you see them on this slide. So collaborative therapists, they really focus on strengths and resiliency. So they ask questions such as, what has worked in the past? What have they done well? What does the client feel proud of or good about, right? What have they successfully implemented from, the previous sessions? What challenges they have overcome, right? So whatever issue that you take as an example, the client has depression, or a family comes with all these different relational conflicts, right? Again, like bringing that conversational partnership, bring it up, and working on facilitating that relational process and asking questions and be curious. Collaborative therapists, they really play into clients' assumptions about their reality and truth. They ask questions, specifically open-ended questions. They ask questions to the clients. They ask questions from the clients about how they rate the issues, right? They probing into how much responsibility the client assumes for the issue. So basically, therapy is client-led, and the therapist does not act as an expert. And as you see here, so the conversational questions, which is about understanding from within the dialogues, like the questions that I just mentioned in the beginning of this slide, and this part. So you ask those questions within the dialogue and the conversations that you're having. And again, like your stance is not knowing, not being expert, and I really want to understand the roots of what's going on and learning from you. So when they have these dialogues and conversation, they listen for pause. They really give the space to clients to have reflection. They pay attention to where they pause and what they are thinking about and talking about. And they sometimes they make these appropriately unusual comments about clients' stories, right? With appropriately unusual comments, you really need to be careful about your alliance, your rapport with the client, your body language, your tone, because appropriate unusual comments does not mean that you want to disrespect the client or being rude. It's just a way of, again, like in a conversation, within a conversation, a way of highlighting some points and challenging clients about some of the beliefs or what they think about truth. One other intervention that they use, as you see here, is what they call mutual puzzling questions and process. And again, like it's about inviting clients to be curious and keep exploring. So you ask open-ended questions about what's going on and the different aspects of the story. The last one is being public, and we already talked about this. It's about sharing your opinion, what you feel, and what you are hearing. So, for example, in a session, a therapist could say, I'm sensing some sort of defensiveness here. Is that true, right? So a lot of times when I work with my supervisees, sometimes because of the power dynamic and ageism and all these different reasons, they feel like and when they are in supervision, they talk about all these thoughts, reflection, feelings. And when I ask them, have you had a chance to share that with your clients, they say no, because I feel like it's just weird. I feel like they may not like it, right? So it's really important, again, like when you want to work on these interventions or these aspects of collaborative therapy, to focus on your alliance and rapport with the client, and then to practice assertiveness, not in a way that, again, like you have, because collaborative therapists, they do not believe that they are the expert, they do not believe in authority kind of like stance. So not in that way, but just again like in way of being public and in honoring sharing dialogues and what you think or feel. One thing that collaborative therapists suggest is reflecting themes. Honestly, I don't think it happens, frequently these days, but it's very interesting. So reflecting themes is when you have clients and you have two-way mirror, and then on the other side there this team of therapists or students who are watching the session, and then after the session or in the middle of the session you invite that group who were watching the session, and obviously the clients, they knew about it and they had the consent, but at some point they go to this shared space, so the clients and the reflective team, they are in the same space, and the reflecting team, they start talking about what they observed and what they saw in a session. It is really interesting, and some of the therapists and mentors, they believe that this whole reflecting themes is about learning to be respectful when you talk about clients. So the way that you talk about clients in supervision, with your colleagues, or whatever, with their consent, the way that you talk when they are not there should be the way that you talk about them if they were there, right? So talking about what you have seen in a session, your observation patterns, all these different things happens in front of the clients in reflecting themes, and it's really an interesting experience. I experienced this when I was studying marriage and family therapy, and honestly, before we had the experience, I was like, what's the point of it's just so weird, what's the point of this? But when we actually had the experience and had the reflecting team, it was really also interesting for the clients, because they observed and they saw that dialogue and that conversation and that relational process between or among the therapists, some therapists who were watching the session. And they also, for the therapists, it's also interesting to talk about all the different patterns that they saw, and tracking questions and everything. And again, like most importantly, learning to be respectful when you talk about clients. Collaborative therapy consider clients as the expert, right? So it has this respect and honor for multiple voices, and they believe that there is no true reality, or one universal reality. And because of that, and that stance of curiosity and cultural humility, it's aligned with diversity and promoting diversity in some sense. I really like this quote by Andersen. It says, the invitation is to remember that we are prejudiced by our understandings and experiences that are influenced by our knowledge, traditions, and yet given this, we must remain humble about our knowing, realize that we can never have complete and coherent understanding of another person, and always be open to learning from and about their uniqueness and the novelty of their life. I really like that quote, and it says a lot about that being humble, and curiosity about people and cultures and different populations. one of the critiques that people say about collaborative therapy, it's the fact that it can be really difficult when a crisis needs immediate attention, right? It is difficult also to be without all these different techniques that we talk about in other theories and approaches. It can be really difficult to guide therapy without those techniques. And if the therapist, you know, if it's done incorrectly by the therapist, it may be just wrong and destructive. And also, some people they're concerned about too much self disclosure in therapy by the therapist. I hope that you enjoyed this lecture, and if you have any reflection or question or comments, please let me know. It is really interesting. I invite you actually to do this, to have a scenario or vignette and to compare how you would do and act as a therapist if your approach were narrative therapy versus collaborative therapy, because in some aspects they are similar, but they are very different in terms of the techniques and the way we do things in therapy with clients. So I invite you to compare that for yourself and let me know if you have any questions. Thank you for watching this.